How to take care of your piercings. Ear piercings are one of the most common types of piercings. The locations of these piercings can range from the earlobe to the curve of cartilage at the top of the ear to the folds just outside the ear canal. Although they're extremely popular and relatively safe, you still need to treat your piercings with care and attention to avoid any complications. This video will focus on top tips for cleaning an ear piercing and signs to watch out for that may indicate an infection. And if you're not sure if you're ready for a piercing, we're here to help you get motivated and ready, so please keep watching. The first thing you should consider is where to place your piercing. Here are some popular options. Earlobe. This is the go-to ear piercing spot at the bottom of your ear. This piercing is easy to clean and to take care of, and it heals much faster than other ear piercings. Helix. This is the curvy tissue at the very top of the ear. It falls into second place after the lobe piercing in popularity. It heals a little more slowly than a lobe piercing, but it's still easy to keep clean. Tragus. Right above your earlobe, this harder section of your ear is on the edge of your face and right in the front of your ear canal. It's not as common as the lobe or helix for piercing and is a little more difficult to take care of. There is some anecdotal evidence that a tragus piercing may have benefits for anxiety and migraines. Now let's get to the cleaning part. Number 1, clean your piercing when you do other regular hygiene habits. Clean it when you brush your teeth or take a shower to give yourself a gentle reminder every day. Number 2, wash your hands. Wash with warm water and gentle soap before you touch your piercing to avoid introducing bacteria to the area. Number 3, clean with a clean cotton pad or swab dipped in rubbing alcohol. Use this around the pierced area a few times a day to remove any bacteria. Number 4, dab but don't wipe the piercing. Dry with a clean towel or tissue so you don't damage the tissue while it's healing. Number 5, apply a small layer of petroleum jelly. Using this around the pierced area will reduce scabs and protect from bacteria. Number 6, clean the pierced area whenever you take the piercing out. This includes when you put it back in too. Bacteria can quickly get on jewelry when you expose it to the air or set it on a surface like a counter or table. Number 7, don't clean your piercing in the bathroom. This is especially true of public ones. Even the cleanest home bathrooms usually have high concentrations of bacteria. Number 8, don't lie on the pierced area for long periods of time. Sleeping or lying down on the piercing can trap moisture or bacteria in the area, increasing your risks of infection. Number 9, don't get any hair or body products in the piercing area. Be careful when you use shampoo, soap, gel, pomade, hairspray, or other products that can get near the piercing and irritate the tissue. Number 10, watch out for abnormal or discolored discharge. See your piercer or doctor right away if you notice any unusual discharge, as it might be a sign of infection. Nose piercing aftercare. Getting a nose piercing is a relatively quick process. The healing process, however, isn't so quick. It takes several weeks and up to a few months for a piercing to completely heal. Within the first few days, your nose piercing will be red, inflamed, and possibly painful. The first step to nose piercing aftercare is cleaning. Your piercer will recommend a saline rinse to use at least twice per day. You may also consider using your own DIY sea salt rinse or even tea tree oil if your nose is especially tender. You'll also want to make sure you leave the original jewelry in place until the piercing heals. Changing out the jewelry puts you at risk for infection. Also, you risk letting the piercing hole close up. Don't touch the piercing unless you're cleaning it with recently washed hands. You may accidentally introduce bacteria and cause an infection. An untreated nose piercing infection can lead to a nasal trauma and a host of other symptoms, including breathing difficulties and a change in the shape of your nose. The Center for Young Women's Health says it takes an average of 2 to 4 months for a nose piercing to completely heal. Your piercer can help you determine this for sure. Once your piercing has healed, you won't have to clean the site as often as you once did. However, you'll still need to clean your nose piercing occasionally to maintain it. This will also help prevent infection and scarring. You'll need to clean a new nose piercing twice a day, but you can do it more often. After several months, when your piercing has completely healed, you can transition to fewer saline rinses and soaks by using them only if the piercing area is dirty or oily. You can also start using mild, unscented soap for healed nose piercings only. How to clean a nose ring. In addition to cleaning your nose piercing, it's important to clean your nose jewelry too. This helps to get rid of any oil, dirt, or debris that's stuck to the jewelry. You may also rinse away potential infection-causing bacteria. New piercings require cleaning around and beneath the stud as you switch to other types of jewelry while your piercing heals. It's helpful to clean the jewelry anytime you clean the piercing. This may be done with regular saline solution or regular soap and water. If you wear silver jewelry in your nose, you'll also want to occasionally clean it with professional silver jewelry cleaner. This helps to get rid of any corrosion that could potentially get stuck in your piercing. How long does it take an ear piercing to heal? Earlobe piercings are the quickest to heal. They typically take about 1 to 2 months to fully heal. Cartilage piercings elsewhere on your ear will take longer to heal. It may take up to 6 months or even a year before a Helix or Tragus piercing is fully healed. While your piercing is still healing, don't take your jewelry out for an extended period. Doing so may cause the hole to close. When can you change out your jewelry? The answer to this question is different for everyone. It all depends on how fast you heal and what kind of piercing you got. If you're unsure if you're ready to change out your jewelry, ask your piercer about a month or 2 after you got your piercing. They can examine the area and give you a definitive answer. How you can get a piercing infection. A piercing is essentially an open wound. An earlobe piercing usually takes 6 to 8 weeks to heal. Cartilage piercings, which take place on the harder part of your ear, generally take longer to heal and can be more prone to infection. There are several ways your ear piercing can get infected. Any bacteria left to fester can quickly turn into an infection. If you touch your piercing with dirty hands or instruments, you can introduce an infection. If the earrings are on too tightly, not allowing room for the wound to breathe can heal and infection can develop. A piercing can also get infected if there's too much handling of the piercing or the post of the earring is rough. An infection can also occur if unsterile instruments were used, if the person piercing your ears didn't use gloves, or if the posts themselves weren't sterile. How to identify an infected piercing. It's fairly easy to identify an infected ear piercing. Symptoms may include yellow pus-like discharge, swelling, redness, ongoing pain or tenderness, itching and burning. As long as your infection is minor, you may be able to take care of it at home. If you've had a cartilage piercing and it seems infected, seek medical treatment. These types of infections are harder to treat and may require oral antibiotics. Significant infections of the cartilage can require hospitalization. Follow these steps to take care of minor piercing infection. Wash your hands before touching or cleaning your piercing. Clean around the piercing with salt water rinse 3 times a day. Use sterile saline or combine a 1/4 teaspoon of salt with 8 ounces of distilled water. Don't use alcohol, hydrogen peroxide, or antibiotic ointments. These can further irritate the skin and slow the healing process. Don't remove the piercing. This can cause the hole to close up and trap the infection. Clean the piercing on both sides of your earlobe. Pat the area dry with paper towels. Other materials may leave behind fibers. After the infection appears to have cleared, continue this cleaning regimen twice a day until the piercing is totally healed. Remember, an earlobe piercing can take 6 to 8 weeks to heal. Routine care is important during that time.